WGU d446 Adult Health 2. What is glomerulonephritis? Inflammation of the glomerulus affects kidney function. Glomerulonephritis, teaching and interventions. Limit proteins and salt in diet and ensure patient finishes all antibiotics. Glomerulonephritis meds. A. ACE and ARBs, pril and sartan. D. Diuretic side. Bypass surgery post-op diet. Small frequent meals 4-6x daily. Wait 30 minutes pre/post eating to drink. Consume protein first. No sugar, alcohol, caffeine. Liquid diet first 48 hours, then pureed diet for 1 month. Bypass surgery post-op teaching. Pouch holds 1 to 2 ounces at a time, size of egg. No NSAIDs. Will need to consume multivitamins and supplements, B12, calcium, iron. Medications should either be crushed or chewable. GERD, teaching and interventions. Low-fat diet, small frequent meals, avoid alcohol and caffeine, no tight clothes around waist, do not lie down 2 to 3 hours after eating, avoid eating 3 hours before bed, HB elevated 30 degrees. Hyperkalemia affect the T wave on a ECG by peaked T waves. Decreases rate and force of contraction. What does hyperkalemia do to the heart? Decreases rate and force of contraction. Hyperkalemia causes. Usually treatment-related. Tissue trauma. Acidosis. Impaired renal function. Hypoaldosteronism. Hyperkalemia signs and symptoms. Asterisk hint think murder. MURDR. M. Muscle weakness. U. Urine, oliguria, anuria. R. Respiratory distress. D. Decreased cardiac contractility. E. ECG changes. R. Reflexes, hyperreflexia or areflexia, flaccid. Hypokalemia affect the T wave on a ECG by flattening T wave. Hypokalemia, effect on heart? Arrhythmias may progress to ventricular fibrillation. Hypokalemia causes chronic use of diuretics, GI loss, excess renal loss, and alkalosis, vomiting, suction. Hypokalemia S/S. Weakness. Irregular pulse. Hypotension. Respiratory distress. Muscle cramping. Decreased muscle tone and hypoactive reflexes. Paresthesias, tingling skin. Mental confusion. TURP. Transurethral resection of prostate. TRP post-op bleeding, what is normal? Immediate, bloody urine. 24 hours, light red/pink urine. 36 hours, max, small blood clots. TRP post-op abnormal. Output less than or equal to input, wanted to be more than input. Things to watch for with CAST care. Hot spots, compartment syndrome, infection, pain, neurochange, capillary refill change. What is compartment syndrome? Increased pressure in muscle compartment of extremity causing impaired circulation and ischemia. What is a fat embolism? Disruption to blood supply caused by fat globules in vessel. Fractures, interventions. Control bleeding, immobilize, ice, elevate, neurovascular check, assess pain and sensation, assess skin temp and color, capillary refill, pulses, movement. HSV, herpes simplex virus. Cold sores and genital warts. Non-curable, active lesions, pain, itch, burn. Genital warts/lesions are priority to report during pregnancy. HSV treatment? Tacyclovir, compress, and petroleum jelly. Initial sign of liver failure? Changes in cognitive function. Liver failure interventions, diet, avoid, and treatment. Low protein, sodium, and fluid diet. Avoid alcohol and NSAIDs. Drug therapy for hepatitis. Tuberculosis signs and symptoms. Night sweats, blood-tinged sputum, productive persistent cough, weight loss. Tuberculosis diagnostic tests. Intradermal injection, chest x-ray, sputum cultures. Tuberculosis precautions. Airborne precautions. Priority for seizures. Airway safety, turn to side, prepare suction, lower to floor, if not in bed. No restraining and nothing in mouth. What is an ischemic stroke? Most common type of stroke in older people occurs when the blood flow to the brain is blocked, usually by the narrowing or blockage of a carotid artery. Ischemic stroke interventions. Thrombolytics W/ in 3 hours. With anticoagulants, antiplatelets, and embolectomy. Ischemic stroke signs? Sudden numbness, weakness, speech difficulty, vision change. What is a hemorrhagic stroke? Bleeding in the brain due to a ruptured blood vessel, aneurysm. Hemorrhagic stroke, interventions. Antihypertensives, surgical aneurysm repair. Hemorrhagic stroke signs. Sudden severe headache, nausea and vomiting, sudden loss of consciousness. Stroke S/S fast. Face drooping. Arm weakness. Slurred speech. Time to call 911. How do you assess pain in an unconscious patient? Facial expressions, vocalization, groans, etc. Change in vitals, restlessness. SIAD stands for what? Syndrome of inappropriate antidiuretic hormone. SIAD, simple meaning. Soaked inside. SIAD signs. Stops urination, low output. Sticky, thick urine. Low sodium, hyponatremia, less than 136, causes headache and high BP. Fluid volume overload equals edema, tachycardia, HTN, crackles, JVD. Mental confusion. Seizure/coma. SIAD interventions. Fluid restriction, stop for and give salt. Drug therapy, diuretics, hypertonic saline, demeclocycline. Monitor for fluid overload. Neurologic assessment. Radiation therapy, teachings for skin site care. Loose clothes. Mild soap and lukewarm water. Topical steroid. Electric razor. Only avoid aftershave and cosmetics. No heat or cool packs. S/S of hypothyroidism. Hypotension, bradycardia, lethargy, cold intolerance, constipation, weight gain, thin hair, brittle fingernails, depression. S/S hyperthyroidism. Hypertension, tachycardia, heat intolerance, exophthalmos, weight loss, insomnia, diarrhea, warm and sweaty, anxiety. Hypothyroidism interventions. Frequent rest, low calories and high fiber, increase room temp and use blankets. Hyperthyroidism interventions. Increase calories and protein, thyroidectomy. Hypothyroidism meds. Levothyroxine and liothyronine. Hyperthyroidism meds. Propylethiouracil, iodine solution, beta blockers, radioactive iodine therapy. Diabetic foot care. Inspect feet daily, clean with soap and warm water, clean socks every day, cut toenails straight across, keep feet dry, no powder or lotion between toes. Peripheral venous disease, PVD. Deoxygenated blood can't get back to the heart, pooling of oxygenated blood in the extremities. Peripheral arterial disease, PAD. Narrow artery, atherosclerosis, where oxygenated blood can't get to the distal extremities, hands and feet. Ischemia and necrosis to extremities. PVD signs and symptoms. V voluptuous pulses equals warm legs. E edema, blood pool. I irregular shaped sores. N no sharp pain, dull pain. Y yellow and brown ankles. PAD signs and symptoms. A absent pulses, absent hair equals cool legs. R round, red sores, blood pool. T toes and feet black. S sharp calf pain, intermittent claudication. Symptoms occur when vessels are 60 to 75% blocked. PVD treatment/meds. Elevate veins. Meds, aspirin, clopidogrel, cholesterol-lowering drugs, statin. Surgery, angioplasty, bypass, endarterectomy. PAD treatment/meds. Dangle arteries away. Perform daily skincare. Stop smoking. Avoid tight clothing. No heating pads. Meds, vasodilators and antiplatelets. PAD teachings. Avoid raising legs above heart. Avoid barefoot. Avoid lanolin between toes. PVD teaching. Keep legs elevated when sitting. Avoid constricting clothing. Avoid extreme temp changes. Do not cross legs. Cotton socks. Congestive heart failure. Think HF equals HF. Keywords to watch for. HF equals heart failure. HF equals heavy fluid. Keywords: new, sudden, worsening, rapid, pink, frothy, crackles, edema. HF pathology. A cardiac disorder that impairs the ability of ventricles to fill or eject properly. The heart cannot pump enough blood to meet the body's needs. Right-sided HFS/S. Right equals rest of body. Fluid is backing into venous system. S, swelling of legs and hands. W, weight gain plus 3 pounds in day or 5 pounds in 7 days. E, edema, pitting. L, large neck veins, JVD. L, lethargy/fatigue. I, irregular heart rate, tachycardia. N, nocturia. G, girth, ascites. Left-sided HFS/S. Left equals lungs, fluid is backing into lungs equals pulmonary symptoms. D, dyspnea/SB. R, rowels, crackles.
orthopnea.
W, weakness/fatigue. N, nocturnal paroxysmal dyspnea. I, increased HR. N, nagging cough, frothy, blood-tinged sputum. G, gaining weight. Asterisk usually develops into HF. HF, treatment. Prills, sartans, Act 1, ACE, ARBs, diuretics. H, Hob. O, oxygen. P, push furosemide. E, N-sodium and fluids. HF, priority interventions. C, count HR and BP. C, change position slowly. B, bad headache, normal. Diabetes mellitus. Blood sugar problem. Diabetes insipidus. A peeing problem increased. Abnormalities in antidiuretic hormone levels. Type 1 diabetes, remember. Type 1 equals none, 0 insulin produced. Type 2 diabetes, remember. Type 2 equals few insulin receptors work in the body. Normal blood glucose levels, 70 to 115. Fasting glucose levels, under 100. Hemoglobin A1C, 6.5 plus. Criteria for metabolic syndrome? You need 3 things. At least 3 characteristics must be present to diagnose metabolic syndrome, ATP3. Obese waist circumference, greater than 35 women, greater than 40 men. HDL, less than 40, high cholesterol. Triglyceride, greater than 150. B/PHTN, over 130 systolic. Fasting glucose, greater than 100 fasting. Samajai effect. Too much insulin given at night causing hypoglycemia at night 2 a.m. to 4 a.m., followed by rebound hyperglycemia in the morning. Samajai effect example. If a client fails to eat her bedtime snack, she might experience the Samajai effect. This abrupt drop in the client's blood glucose level during the night is followed by a false elevation. Ketoacidosis, DKA. Insulin deficiency - decreased glucose utilization - breakdown of fat stores - ketones accumulate. Rapid-acting insulin. Aspart, Lispro, glycine. 15-minute onset. Never give W/out food. Regular, short, acting insulin. Humulin R, Novolin R. Onset W/in 30 minutes. Only one we can give via 4. NPH, intermittent, acting insulin.
Himilin, Nufulin.
Onset W/in 1.5 hours, peak 2 to 5 hours. Long-acting Lantus, insulin. Glargine. Steady control, usually given at night. Once every 24 hours. Do not mix W/other insulins. Hyperglycemic level? Blood glucose over 115 and A1C 6.5 plus. Hyperglycemic signs and symptoms. Hint, 3 Ps. P. Polyuria. P. Polydipsia. P. Polyphagia. Hypoglycemic signs and symptoms. Cool, pale, sweaty, nervous, tachycardia, fatigue, shaking. Think cool and clammy, need some candy. Hypoglycemic levels. Blood glucose 70 or less. What is worse, hypoglycemia or hyperglycemia? Hypoglycemia because the brain needs constant glucose to function and does not have a reserve. ALS. Amyotrophic lateral sclerosis, Lou Gehrig disease. What is ALS? Rare progressive neuromuscular disorder marked by the loss of motor neurons. Unknown cause. More common in white, men, and military veterans. Approximate 10% genetic. Limb-onset ALS. Initial involvement in extremities, trouble with tasks involving fine motor skills. Bulbar, speaking, onset ALS. Problem speaking, e.g., slurred speech, sounds like they're drunk. ALS signs and symptoms. Pain, sleep disorder, spasticity, hyperreflexia, drooling, emotional lability, constipation, esophageal reflux, progressive muscle weakness and atrophy. ALS meds. May slow decline. Riluzole and Edravone. ALS interventions. Facilitate communication, reduce aspiration risk, early identification of respiratory problems, decrease pain, decrease fall risk, provide diversional activities, provide compassionate end-of-life care. Med dosage, manual forceps. Total volume, ml/total time, min, x drop factor, GTT/ml equals rate of flow, GTT/ml. V/TXD equals R. COPD stands for chronic obstructive pulmonary disease. Chronic bronchitis patho. Inflammation of bronchial tubes, excessive mucus production as a result, blue bloater. Emphysema patho. Air sacs of the lungs are damaged and enlarged, causing hyperinflation and breathlessness, pink puffer. Chronic bronchitis S/S, think blues. B. Blue skin, hypoxia. L. Long-term cough, chronic and worse in the morning. U. Unusual lung sounds, crackles and wheeze. E. Edema. S. Sputum, thick. Emphysema S/S, think pink. P. Pursed lip breathing. I. Increased chest size, barrel chest. N. No cough. K. Keeps tripoding. COPD manifestations. Chronic air trapping, CO2 high. 1. New dyspnea at rest, shortness of breath. 2. Weight loss. 3. Prolonged expiration. 4. Clubbed fingers, long-term hypoxia equals vasodilation. Huff cough does what? Can help clear mucus from lungs. COPD interventions. Small frequent meals, high calorie and high protein, tripod position, diaphragmatic breathing, pursed lip breathing. COPD O2 therapy for hypoxia target range. SpO2 88% to 92%. Signs of hypercapnia. Headache. Dyspnea. Difficult to arouse asterisk. Confused. Altered respiratory patterns can be increased or decreased. CKD stands for chronic kidney disease. CKD interventions related to calcemia. In hypercalcemia, non-calcium-based phosphate binders. In hypocalcemia, calcitrol. Sodium polystyrene sulfonate. Gluconate and calcium acetate. What is uremic frost? Crystallized urea on the skin when blood levels are up to 200 milligrams per deciliter. CKD risk factors. Ethnic minority, family history, age greater than 60 years. CKD diet restriction and when to take phosphate binders. Avoid protein-rich foods. Phosphate binders taken with meals. Peritoneal dialysis, PD. A method of removing waste products and excess fluid from body when the kidneys are not functioning properly, using peritoneum in the client's abdomen as a membrane across which fluids and dissolved substances are exchanged from blood. What is the peritoneum? Thin, two-layered membrane that lines abdominal cavity and covers most abdominal organs. What does CAPD stand for? Related to dialysis. Continuous ambulatory peritoneal dialysis. What is CAPD? Continuous ambulatory peritoneal dialysis. No machinery is used, manual procedure. Tube permanently inserted through the abdomen to allow dialysate to be emptied and replaced daily. What is dialysate? Cleansing fluid used to remove waste and excess fluid. What is peritonitis? Asterisk, usually life-threatening. Inflammation of the peritoneum, membrane lining the abdominal cavity and surrounding the organs within it. What is hemodialysis? Cleans the blood of accumulated waste product. Dialysate does not need to be sterile. Warming solution increases effectiveness. Heparin sodium is used to prevent clots. Dialysis complications. Hepatitis, infection, post-treatment blood clots. What is AV fistula? How do you check patency? Joining of an artery and vein together, used in some dialysis patients to reduce risk of infection. Assess patency by palpating for thrill, buzz, and brute swoosh. What is arterial steal syndrome? Signs? Results from vascular insufficiency after the creation of a fistula. Signs: pallor, diminished pulse, left hand pain. What is disequilibrium syndrome? Signs? Caused by the rapid removal of solutes from the body during hemodialysis. Signs: headache, nausea, restlessness, mental confusion, decreased level of consciousness, vomiting, twitching, possible seizure. SRD stands for end-stage renal disease. What is ESRD? Renal failure. The kidney's lost ability to remove waste and balance fluids, kidney failure. ESRD, signs and symptoms. Restless leg, hysterexis, hand flap tremor, nocturnal leg cramps, muscle twitching. ESRD, treatment. Dialysis, kidney transplant. What is pneumonia? Infection that inflames the air sacs in lungs. They may fill with fluid. Pneumonia signs and symptoms. Fever, productive cough, a sign of infection, rowels, crackles, and rhonchi SOB. Pneumonia is diagnosed by chest x-ray, sputum gram stain, and culture. Pneumonia treatment. Antibiotics and fluids. What type of precaution is pneumonia? Droplet. What is asthma? Constricting of the airway due to inflammation. Asthma symptoms? Wheezing, coughing, chest tightness, shortness of breath. Asthma treatments? Bronchodilators or corticosteroids. Signs of asthma exacerbation. Breathless at rest. SP during exercise. Increased mucus production. Hunched forward. Speaks in words rather than complete sentences. Agitated. Asthma exacerbation treatment. Oxygen. Then albuterol and ipratropium. Then 4 or oral corticosteroids. What is an aortic dissection? The separation of the muscular wall from the membrane of the artery, putting the point at risk for aortic rupture and death. Aortic dissection S/S. Aneurysm bursts. Sudden, severe persistent pain described as tearing or ripping in anterior chest and back. Pallor, sweating, tachy, different V/P in each arm, paralysis of lower extremities. Asterisk shock. Life-threatening. How is aortic dissection DX? CT chest with 4 contrast dye. Who is at the highest risk for aortic dissection? 60 to 70-year-old patients. Aortic dissection treatment. Lower BP with 4-beta blocker or nitroprusside. Plan for surgical repair. Spontaneous pneumothorax simple definition. Collapsed lung. Spontaneous pneumothorax S/S. Sudden sharp chest pain, shortness of breath, tachypnea, tachycardia, diminished and absent lung sounds, hypoxic. Who is higher risk for spontaneous pneumothorax? Young males. Interventions for spontaneous pneumothorax. Chest tube, to reinflate lung, continuous pulse ox monitoring, chest x-ray. HTN stands for what? Why is it called the silent killer? Hypertension. Silent killer, often asymptomatic. Primary hypertension. High blood pressure, the cause of which is unknown. Secondary hypertension. High blood pressure caused by the effects of another disease. Common secondary HTN symptoms? Fatigue, palpitations, dizziness, angina, dyspnea. HTN diet restrictions. Low sodium, low fat. Risk for HTN? African Americans. Alcohol. Obesity, BMI greater than 30. Those who do not exercise. Smoking. Poor/homeless. FAM-HX. HTN medications. Diuretics. Antihypertensives. ACE inhibitors. Calcium channel blockers. HTN leads to changes in renal blood flow and eventually decreased renal function. Hypertensive crisis BP. Systolic BP 180 and or diastolic 120. Hypertensive crisis cause? Non-adherence to med plan or undermedicated drug use. Hypertensive crisis signs and symptoms? Severe headache, blurred vision, chest pain, stroke, seizure, coma, death, flushing, cold, clammy skin, tachycardia, nausea and vomiting/nosebleed. Hypertensive crisis intervention? Obtain baseline vitals, continuous BP and ECG monitor, auscultate heart and breath sounds, insert for hypertensive, baseline blood work, give O2. What is Addison's disease? Adrenal insufficiency. Hypofunctioning, doesn't produce enough cortisol. Addison's disease S/S. Hypercalcemia, decreased serum cortisol, anorexia/weight loss, hyponatremia, vitiligo/hyperpigmentation. Thrombolytic meds do what? Dissolve clots rather than prevent them, not used in venous thrombosis cases because of high bleeding risk. Thrombolytic meds? Plays TPA. Signs of hyperpituitarism. Visual disturbances, severe headaches, back/joint pain, changed in menstrual cycle, increased growth hormone. What is pulmonary edema? Excess fluid in lungs, wet lung. Pulmonary edema S/S. Crackles. Mental changes anxious/restless. Severe dyspnea. Orthopnea. Pink frothy sputum asterisk. Cough. Tachycardia. Cyanosis. Jugular venous distension. DVT stands for deep vein thrombosis. What is a DVT? Blood clot in a deep vein, typically legs. Signs of DVT. Pain and cramping in calf. Redness/skin discoloration. Swelling, increase in diameter of extremity. Warmth. DVT labs. PT, APTT, D-dimer, hemoglobin, HCT, fibrinogen, platelet count, RBC. DVT-DX by US/Doppler of the extremity. Sometimes MRI/CT. P stands for pulmonary embolism. What is a P? A blood clot becomes lodged in the pulmonary artery and blocks blood flow to the lungs. Who is highest risk for a DVT and P? Immobilized patients. DVT/P prevention. Early ambulation, leg elevation, active leg exercises, intermittent pneumatic calf compression. No pillow under knee can cause venous stasis. What is venous stasis? Slow blood flow in legs resulting in blood pooling. Appendicitis labs/diagnostics. 1. Elevated WBC, leukocytes with shift right. 2. CT or ultrasound is diagnostic. Appendicitis S/S. RLQ pain, low-grade fever, nausea, rebound tenderness at McBurney's point. Emergency symptom involving appendicitis? Pain suddenly disappears, signs of a rupture, peritonitis. Metformin treats? Type 2 diabetes. What is cardiac tamponade? Compression of the heart by an accumulation of fluid in the pericardial sac. Cardiac tamponade S/S. Tachycardia. JVD. Distant/muffled heart sounds. Falling BP. What is Raynaud's disease? Constriction of the small vessels in the fingers and toes. What is Cushing syndrome? Chronic exposure to excess corticosteroids, too much cortisol. Cushing syndrome S/S. Moon face. Buffalo hump. Hyperglycemia. HTN. Hirsutism. Edema. Cushing's interventions. Monitor electrolytes. Increase plus K, calcium protein. Reduce steroid use if applicable, taper. What is Conn syndrome? Primary hyperaldosteronism. Signs and symptoms of Graves' disease. Enlargement of your thyroid gland, goiter. Sudden weight loss. Tachycardia. Heat sensitivity, anxiety, bulging eyes. Asterisk same symptoms as hyperthyroid. What is Graves' disease? An autoimmune disease characterized by thyroid enlargement and excess thyroid hormone secretion. Graves' disease treatment? Antithyroid medication, carbimazole. B-blocker, propranolol for symptom control. ACS stands for acute coronary syndrome. What is acute coronary syndrome? Any condition brought on by reduced/blocked blood flow to heart. X, MI, unstable angina. What is a coronary angiography? Uses X-ray and contrast to examine heart's blood vessels. What is coronary angiography used for? To identify blockages or narrowings, helping diagnose and plan treatment for coronary artery disease. Coronary angiography is also called cardiac catheterization. What is thrombocytopenia? Low platelet count, less than 150,000. Thrombocytopenia, signs and symptoms. Signs of hemorrhage, tachycardia, hypotension, fainting, dizziness, abdominal pain, decreased quantity of blood. What is autonomic neuropathy? Type of diabetic neuropathy that affects all systems. This leads to hypoglycemic unawareness, bowel incontinence, diarrhea, urine retention. What is diabetic dermopathy? Diabetic shins and legs, typically painless and harmless. What is fibrinolysis? Natural process that breaks down blood clots. DC stands for what? Disseminated intravascular coagulation. What is DC? Abnormal clots form inside blood vessels and use up blood's clotting factors, which can lead to massive bleeding in other places. What is hemophilia? Decrease the clotting ability in a patient. Rare condition. Digoxin does what? Improved myocardial contraction equals increased cardiac output. Reduces heart rate. What is a surgical timeout? A period where the surgical team double-checks all the details of the patient and surgery prior to the incision. Can be done more than once if more than one procedure is done on the same patient. Post-thyroidectomy interventions. Assess for tetany, keep O2/suction/tracheostomy tray available. Assess for signs of tracheal compression every 2 hours. Keep 4 calcium available. What is a radical nephrectomy? Removal of kidney, the adrenal gland, surrounding fascia, and draining lymph nodes. What is radiofrequency ablation? Destroys tumor by using heat from radiofrequency. What is an ileal conduit? It is used to divert urine outside of the body's stoma when bladder has been removed. The conduit cannot store urine the way the bladder does, therefore, urine will flow continuously, and an appliance must be worn as a collection device. Marsupialization is used for the creation of permanent opening of a diverticular sac in vagina to allow drainage. What is dystopic lithotripsy? Uses ultrasonic lithotrite to destroy renal stones. What is lithiasis? Formation of stones. Post-lithotripsy teaching. Strain and monitor your urine. Antibiotics, finish all. Drink lots of fluids, 2 to 3 L. Bruising, hematuria are expected. Report S/S of infection or difficulty urinating. What is papillary muscle dysfunction? Complication of MI and is assessed by auscultation of new murmur at cardiac apex. Levothyroxine. Synthetic thyroid hormone used to treat hypothyroidism. PCI stands for percutaneous coronary intervention. PCI is what? Non-surgical procedure to treat blockage in coronary artery in cases of MI. How do beta blockers work? Reduce cardiac output and lower HR and dilate blood vessels. What is the suffix of beta blockers? Who can't have them? Bolol. Contraindicated, asthma and HF point. What are ACE inhibitors? Angiotensin converting enzyme inhibitors, PRILs. What do ACE inhibitors do? MOA. Block conversion of angiotensin I to angiotensin II. ACE inhibitors treat hypertension, heart failure, diabetic neuropathy, left ventricular dysfunction following MI. Calcium channel blockers MOA. Cause coronary artery vasodilation. Reduce the workload of the heart. Result, decreased myocardial oxygen demand. Depine. Calcium channel blockers treat hypertension, angina. Spironolactone, what type of diuretic? What do you monitor for? Potassium sparing. Monitor, hyperkalemia. Potassium sparing diuretics treat hypertension. Edema caused by heart failure. Cirrhosis of the liver. Nephrotic syndrome. Hypokalemia. Furosemide is what type of diuretic? What do you monitor for? Loop diuretic, potassium wasting. Monitor, hypokalemia. Furosemide treats hypertension, heart failure, edema. Signs of hemorrhage? Pallor, cold, clammy skin. Decreased MAP. Decreased BP, pulse pressure, and urinary output. Increased HR/RR. Signs of varicose veins. Presence of ankle edema, increased leg fatigue, report of leg fullness, and pruritus. What is rheumatic fever? It is an inflammatory disease that may develop after an infection with streptococcus bacteria, such as strep throat or scarlet fever. Rheumatic fever, signs and symptoms. Heart murmur, opening snap, joint pain, painless nodules over elbow, previous sore throat and upper respiratory infection, abdominal pain. Risk factors of colorectal cancer? Family HX of polyposis or colon cancer. HX of UC. Change in bowel pattern/dark tarry stool. Unintentional/unexplained weight loss. What is the Valsalva maneuver? Bearing down. When to avoid the Valsalva maneuver? HTN. High ICP. CAD. Recent eye surgery. Abdominal surgery risk? Paralytic ileus. Muscles of the intestines stop working. Due to handling of intestines during surgery. Priority to inspect abdomen for distribution. What is descents? Reopening of a wound. What is evisceration? Incisions are giving away and internal organs are seeping through the incision. Ritonavir treats what? Treat HIV infection. Diabetic neuropathy is the most common cause of diabetic foot ulcers. Osteomalacia/rickets. Soft bone disease. Caused by vitamin D deficiency. Osteomalacia priority? Ensure safety precautions to prevent fractures. What is a thyroid storm? Massive amounts of thyroid hormone released into circulation, life-threatening. Thyroid storm signs and symptoms. 1. High fever. 2. Diaphoresis, excessive sweating. 3. HTN/tachycardia. 4. Delirium/confusion. 5. Mental status change/unconsciousness. ICP. Increased cranial pressure. ICP pediatric. Increased systolic, widened pulse pressure, bradycardia, irregular respiration, fixed and dilated pupils. Spinal shock S/S. Reaction of SCI. Flaccid paralysis, loss of feeling below the level of injury, loss of bowel and bladder control, temp affected. Temporary, if the cord is not seriously injured. What is autonomic dysreflexia? A life-threatening condition in a client with high spinal cord injury above T6. Autonomic dysreflexia S/S. Severe pounding headache. Hypertension, extremely high. Profuse sweating, especially forehead. Bradycardia. Nasal congestion. What causes autonomic dysreflexia? Bladder/bowel distension. Pain. Tactile stimulation. What is sepsis? Life-threatening organ dysfunction caused by a dysregulated host response to infection. Sepsis labs and vitals. Temp, 38C or 36C. Heart rate greater than 90. Respiration greater than 20. WBC greater than 12,000 or less than 4,000. What is a myelogram? Image test using X-ray and contrast or CT scan to examine spinal canal. Pulmonary embolism, signs and symptoms. Sudden onset dyspnea, tachycardia, tachypnea, cough, crackles, hemoptysis, hypoxia, midsternal pain. What is a subdural hematoma? Intracranial bleeding that occurs beneath dura mater, usually from head injury. What is leukemia? Group of cancers that begin in bone marrow and result in high numbers of abnormal WBC. Leukemia, signs and symptoms. Fatigue, pale skin, fever, frequent infections, bleeding or bruising easily, petechiae, bone pain. What is mannitol? Diuretic. What is mannitol used for? Decreases intraocular and intracranial pressure. What is myasthenia gravis? A neuromuscular disorder characterized by muscle weakness. MS stands for multiple sclerosis. MS signs and symptoms. Diplopia, ptosis, muscle weakness and spasm, difficulty with coordination and balance, bowel and bladder dysfunction, joint pain, dysphagia. Active GI bleed/hemorrhage symptoms. Tachycardia, hypotension, tachypnea, bright red emesis, rapid drop in hemoglobin. GI bleed needs stat? RBC order, type and cross-match, fluid bolus. PUD stands for what? Peptic ulcer disease. PUD S/S. Pain may radiate to back. Cramping, burning. Heartburn/bloating. Anorexia, nausea, vomiting. Bloody or black stool. Low HNH. Gastric or fecal occult blood may be found. Epigastric pain relieved with food. Foods to avoid with PUD? ETOH, caffeine, spicy or acidic foods, carbonation. What is a masked face typically seen with Parkinson's disease? Reduced facial expressions and limited movement, hypomimia. Bacterial meningitis is a life-threatening infection of the membranes that protect the brain and spinal cord. Bacterial meningitis, signs and symptoms. Mental status change, fever, headache, stiff neck, nausea, vomiting, sensitivity to light, rash, increased WBC. Bacterial meningitis treatment. Antibiotics. Analgesics. Meningitis priority. Droplet/contact precautions. Assess for increased ICP. Monitor neurostatus. Keep HB at 30 and avoid flexion of the body. Seizure precautions. How do you DX meningitis? CT scan. Lumbar puncture. Fluid will be cloudy if positive. Positive Kernig's and Brudzinski sign in what disease? What are they? Meningitis. Kernig's, lay supine. Bend knees 90, extend knees. If pain is present, that is plus sign. Brudzinski, lay supine, passively moves neck. If his or knees move involuntarily, that is plus sign. How do you minimize increased ICP? Keep room dim and quiet. HB 30 degrees. NO coughing/sneezing/bending. Take stool softeners. Priority for cervical injury. Respiratory/airway, mechanical vent. Keep the patient still. Avoid moving the head or neck. If necessary, to move to keep head, neck, and back aligned. Cervical injury typically result in quadriplegia. What is emesis? Vomiting. Diverticulosis diet. High fiber. Eczema treatment. And therapeutic outcome? 10% urea cream. Therapeutic outcome: help the skin retain moisture, reduce dryness and flaking, and improve the overall skin barrier. Chest pain versus heart attack or angina versus MI. Angina, chest pain, pressure, tightness, or squeezing in the chest. Relieved with rest/nitro. MI, heart attack, more intense, prolonged pain that may radiate to the arm, jaw, or back, elevated troponin levels. Myocardial infarction DX. 1. ECG. 2. Cardiac enzymes, gold standard. Elevated troponin levels. Drawn once on admission and Q8 HRS until 3 samples are obtained. The higher the peak and longer enzyme levels remain elevated, the more severe the myocardial injury equals, worse prognosis. Priority interventions for MI. Morphine. Oxygen. Nitro. Aspirin. Get EKG before anything with MONA. What is rheumatoid arthritis? Chronic autoimmune disease that causes bilateral inflammation in the joints. Rheumatoid arthritis symptoms. Slow onset of fatigue. Symmetrical swollen, stiff, painful joints. Pain worse in morning/at rest. Boutonniere fingers. Swan fingers. Subcutaneous nodules over bony prominences and tendons. Rheumatoid arthritis treatment. Goal of TX, reduce inflammation and pain, promote joint function, and prevent joint destruction and deformity. MEDs, NSAIDs, corticosteroid, DMARDs, slow progression. Passive and active ROM. Heating and cooling agents. Splinting during acute flare-up. Energy conservation. Warm bath/shower before bed. DMARDs drugs. Methotrexate. Hydroxychloroquine. Notify HCP if vision changes occur. Post-amputation care. Keep limb in the extended position. When changing dressings, use a sterile technique. Use compression bandages. Turn client 3x a day to previous hip flexion contracture. Encourage prone position. Wrap the stump to form a cone shape in order for future prostheses to be fitted. Monitor and report any signs of gangrene, open areas, poor circulation. Post-amputation, do not use pillows under the residual limb when patient is on his/her back. Do not allow residual limb after 48 hours post-op. Do not use powders, lotion, alcohol on amputation site. Amputation complications. Hemorrhage, infection, phantom limb pain, neuroma, flexion contracture, negative self-esteem. Post-amputation, what should you have at bedside? Keep tourniquet in reach as hemorrhage is a major concern. What is pernicious anemia? Autoimmune disease that prevents the body from absorbing vitamin B12. Pernicious anemia treatment. Vitamin B12 injections. Third-degree burn affects what layers? Damages all layers of the skin, including the epidermis, dermis, and sometimes the subcutaneous tissue. Full-thickness burn is the same as third-degree burn. Full-thickness burns risks/effects. Absent sensation and pain due to the destruction nerve endings. High infection risk. Fluid/electrolyte imbalance, hyperkalemia. Burn priority interventions. 1. Fluid resuscitation, most important. LR. 2. Albumin infusion. 3. Vitals. 4. Look for urine output equals good. Burn wound care. Prevent infection, patient's own bacteria. Prevent cross-contamination. Assists the body's healing process. Cleanse, debride, coverage. Topical creams, water-based. Biological dressings/grafts. Prevent contractures with positioning, ROM exercises, ambulation, pressure dressings. Emergent phase of burns. Tetanus toxoid injection. Respiratory support. Fluid resuscitation, isotonic solution, first choice LR for NS. Prevention of shock. Pain management. How do we know if fluid resuscitation is working? Urine output greater than 30 milliliters per hour. BPW/systolic greater than 90. HR less than 120 BPM. Inhalation burn injury. Carbon monoxide poisoning. Inhalation injury above the glottis, hot air, steam, or smoke. Inhalation injury below the glottis. S/S of inhalation injury. Facial burns. Singed nasal and facial hairs. Carbonaceous sputum, soot, hypersecretion. Naso or oropharynx erythema. Inability to swallow. Hoarseness, grunting, brassy voice. Rowels, Ronchi, diminished breath sounds. What is a nephrectomy? How long is recovery? Kidney removal. Recovery can take 3 to 6 weeks, may experience pain, bruising, or redness around the incisions. Open-angle glaucoma definition. A common and serious eye condition that occurs when fluid in the eye doesn't drain properly, causing pressure to build up and damage the optic nerve. Open-angle glaucoma, signs and symptoms. Early symptoms, peripheral vision loss. Later symptoms, missing letters from words or noticing stairs while walking. Open-angle glaucoma treatment. Eye drops, laser treatment, or surgery as last resort. Cataract surgery discharge instructions. Proper eye drop application. Wear sunscreen. Avoid things that increase IP. Vision improves in 4-6 WK. AHDR stands for acute hemolytic transfusion reaction. What is hemolytic transfusion reaction? Destruction of red blood cells as a result of transfusion of incompatible blood. AHDR-S/S. Chills, fever, pain, especially along the foreline, in the back or in the chest, hypotension, dark urine. AHDR priority intervention. Discontinue blood, flush with saline, send all blood supplies back to blood bank, and contact HCP. ABC of blood product reactions? Assess and stop the transfusion. Be prepared to intervene. Check vitals/monitor/document. Blood transfusion reactions. Allergic most common with hives/itching equals give Benadryl. Febrile, D/TWBC equals give Tylenol. Acute hemolytic, rare but most serious, when blood types don't match, D/T human error, S/S, chills, fever, lower back pain, nausea, hypotension, bronchospasm, vascular collapse, DAC. Circulatory overload, infusion to fast, dyspnea, orthopnea, tachycardia, anxiety, pulmonedema equals give diuretics. Labs for infection. WBC count, between 5,000 and 10,000. O left shift, when immature WBC are released BC the body is overwhelmed by infection. O ESR, erythrocyte sedimentation rate indicated inflammation in the body. O CRP, C-reactive protein indicated inflammation. HCT, hematocrit, percent of RBC volume. What does HCT tell you? Ratio of volume of RBCs compared to total blood volume. What does hemoglobin measure? Hemoglobin, the oxygen carrying capacity of the blood. Low hemoglobin and HCT. Anemia / if the respiratory is high, then there is a loss of blood. Possible hemorrhage. High hemoglobin / HCT. Dehydration / COPD. ETOH. Cigarettes. Diuretics. WBC's shift right. Typically seen with anemia like B12 deficiency. WBC's left shift. Shows infection, usually bacterial. Colchicine does what? Relieves joint pain caused by an acute gout attack. Colchicine teachings. Give with meals, anti-gout, remember if diarrhea develops, stop the drug. Allopurinol does what? Decreases uric acid production in gout point. Allopurinol PT education. Drink 2 L of water daily. Take with food to relieve stomach issues. Avoid foods high in purine. Post-TRP care. Continuous bladder irrigation, CBI. Clots are normal for 24 to 36 hours. Risk for hemorrhage, hypovolemic shock, infection. Check temp Q2H. Early ambulation. TRP complications. Urethral trauma. Urinary retention. Bleeding. Infection. What is BPH? Benign prostatic hyperplasia, enlarged prostate. BPH patho. Non-cancerous enlargement / hypertrophy of prostate. Typically, it compresses the urethra and surrounding bladder, causing difficulty urinating. S/S of BPH. Urinary retention, the sensation of incomplete emptying. Nocturia / frequent urination. Straining to pee / weak or intermittent stream.